Today, we're announcing 30 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 579. There are currently 11 individuals in hospital. 4 of those are in ICU. We now have 176 people that can be considered to be recovered. So that's 39 more than we had yesterday, and that's good news. And as we move through this, we'll continue to have more and more people recovering. As part of that, we now, as of today, we've had 18,453 people, or Nova Scotians, who have been tested and are negative. As you've heard me say before, it's testament, the ability to have so many people tested is testament to my colleagues at the lab. And yesterday they processed 1,065 tests, and so they continue to do great work. I know that there's been a lot of interest in the numbers related to long-term care facilities around COVID-19, and it's an area that I've been asked about, and we've certainly done some work in that. So as of today, if people who receive the news release that you can see, we're going to start reporting on a daily basis as part of the news release numbers related to long-term care facilities. Just want to remind folks, those numbers are collected and they're reported as of a certain point in time early in the day. And things do progress throughout the day, but with the numbers, we will stick with the numbers that we get and report first thing in the day. So as of today, I can tell you we now have 7 licensed long-term care facilities that have cases of COVID-19. And in total, amongst those 7, or that's the 7 facilities, we've had 42 residents who have tested positive, along with 23 staff. As we've talked about previously, protecting long-term care facility residents, supporting our long-term care facilities with comprehensive steps from the health system approach is a priority for us in Nova Scotia. It's a key part of our health system response plan. As we've talked about, we've started with several weeks ago preventing visitors, preventing trips out from the facilities. We now have comprehensive directive in place, which deals with all the steps that long-term care facilities need to take, both to prevent cases and how they respond if they do get cases and even an outbreak. We are now providing masks and directed that all frontline healthcare providers, including those in long-term care facilities, wear masks as a preventive step to minimize them transmitting the virus to their coworkers or to residents. So that it remains an area of concern. It remains a focus of attention as well as part of our response here in Nova Scotia. And I just want to end off by saying that as we've talked about since the modeling, I've had a number of questions about that. But the overall message is that many Nova Scotians are following public health directives, doing what we're asking, telling them to do. We are seeing the impact of that, comparing our actual epidemiology to some of the modeling. We are certainly seeing that the impact of strong adherence to those public health measures. So we continue to have new cases, but we're not seeing that a dramatic spike in cases. We have a couple of areas concerned that we have robust response plans in place. So while it's concerning, we're doing some good things here in Nova Scotia. We need to continue to do all those good things for the weeks ahead. But I want to take the opportunity to thank all Nova Scotians who are doing the many hard things that we're asking them to do, but all important to help us prevent the spread of COVID-19 and minimize its impact.